Let's break down the science behind using the safe days method so as to prevent pregnancy. Okay, let's get started. Now, I want us to understand that safe days, these are the days within your menstrual cycle, within a woman's menstrual cycle, in which, in case they actually have unprotected intercourse, okay, unprotected, very important, they can actually not conceive. There are low chances of actually conceiving. I want us to understand that. Now, for you to use this safe days method, in order to prevent pregnancy, you need to make sure that you have a lot of things, you get things right. Okay? This safe days method works around two things. Now, there's what they call the sperm. Okay? And there's what they call an egg, which is usually the ovum. So, for the safe days method to work, those two must not miss to bring about what they call fertilization. Okay, now usually a lady's egg, when it is released, for someone to conceive, the sperm must meet the egg so that you can actually form a zygote, which later implants into the uterus, or that bring about the pregnancy. When the egg is released from the ovary, it has a duration of viability of 24 48 hours. Okay, 24 to 48 hours. That is the first thing you need to know. Now, the other thing is that a sperm can actually stay in a female genital tract from 3 to 5 days. Let's keep note of that. So those two must be kept into check. The duration of the ovum, that is also known as the egg, and then the duration of the sperm in the female genital tract. Those two should never have the intersection. If we're actually using an example of a menstrual cycle, which is approximately 28 days, okay? Now in 28 days, usually the luteal phase and the follicular phases are the phases of the menstrual cycle. So if you get 28 days minus 14 days of the luteal phase, you actually come with the 14 days. Okay, that means the ovulation day of the 28-day cycle is going to be around the 14th day of the cycle. Let's keep noting that. So if someone actually has unprotected intercourse around the 14th day, the high chances of actually them becoming pregnant. So basically, days, if you actually look at the duration of the sperm, 3 to 5 days. Okay, so you actually try to make sure you don't have sexual intercourse 3 to 5 days before ovulation. I tend to be for you to be very secure, because the ovulation day can fluctuate a little bit and you might not get it right, because you might need additional tests to actually confirm the ovulation day of the cycle. So you might need to do additional tests to confirm that. So I tend to might need to add 3 to 5 days so that you can actually take that margin. So 3 to 5 days before ovulation, 3 to 5 days after ovulation, so that you can actually have that window as your unsafe days. Then the other days in the menstrual cycle are the safe days. What are the days in which you have low chances of getting pregnant? If you're actually using this safe days method, I would actually encourage you, if you want to actually prevent pregnancy, you might need to incorporate other methods on how to prevent pregnancy into your life. For example, using condoms, okay? Because safe days method needs a lot of discipline, a lot of compliance, so that you actually prevent pregnancy. You probably need to consider other modes of actually preventing pregnancy. If you get value in this video, hit the subscribe button. See you next time.